Welcome to our Evergreen Nurses channel. Today I am going to discuss with you about an important topic, that is pneumonia. Pneumonia in children is a major concern in developing countries like India. It is the second leading cause of death in children under the age of 5. Let us see this important topic in detail. So before we are going to the topic in detail, first we can see what is respiration. Respiration is an act of inspiration and expiration. So in which the movement of oxygen from the outside of the environment to the tissues and it passed through the respiratory organs such as bronchi, bronchioles, alveoli, and then it reached the bloodstream. From there, oxygen taken to the tissue for utilization. Same way, the carbon dioxide returned from the tissues and through the bloodstream, it eliminates to the alveoli, bronchioles and bronchi, and finally through the nose, it is exhaled in the environment. This is the normal function of the respiration. So, any alteration in this physiology lead to respiratory problem. So, in case of pneumonia, respiratory problem occur due to inflammatory process. Let us see what is pneumonia. So, first we can see the definition of pneumonia. Pneumonia is an inflammation with consolidation of the parenchyma cells of the lungs. So, in which consolidation means a state of being solid with the exudate or pus. So, in pneumonia, the affected lung become solid and it is filled with pus. Let us see the classification of pneumonia. The classification of pneumonia having two types. One is based on the anatomical classification, another one is based on the etiology. So, in anatomical classification, we have three types. First one is the bronchopneumonia, second one is the interstitial pneumonia, and the third one is the lobar pneumonia. First, we can see the bronchopneumonia. In this, the terminal bronchioles are affected and become exudate with the pus or patches. So, this is the common pneumonia we can see among the younger children. Then next one is the interstitial pneumonia. Here, the interstitial tissues of the lungs will be affected. Then lobar pneumonia. Here, either one or more lobes are affected. You can see the picture. This picture, it clearly shows that different areas of lobe affected with the pneumonia. Then, after completion of this anatomical classification, we can move on to the etiological classification. In the etiological classification, we have bacterial pneumonia. So, this is the commonest pneumonia among the children. The bacterial pneumonia mainly due to bacteria such as pneumococci, streptococci and the staphylococci. Let us see the viral pneumonia. So, the viral pneumonia is mainly due to the viruses like respiratory syncytial virus, adenovirus and the influenza virus. Next, we can see the fungi. The pneumonia also caused by fungi. That example, that aspergillosis is also producing fungal pneumonia. We have other types of pneumonia also like aspiration pneumonia and hydrostatic pneumonia. Aspiration pneumonia mainly occurs because of aspiration of food and fluid. This is common among the children, and also during the newborn period, aspiration pneumonia is occur because of aspiration of amniotic fluid that happen during the birth process. Hydrostatic pneumonia is mainly due to prolonged bedridden. So till now we have discussed about the classification of pneumonia. Let us see the pathology of pneumonia. Before talking about the pathology of pneumonia, we have to see what is happening in the physiology of the lung. So, you can see this picture. In one side it is showing that normal lung, in other side it shows the abnormal lung, that is infected lung. So, in the normal lung, the alveoli and the bronchi, bronchioles, everything is clear. So, the air is going inside freely and it is coming out freely. So, whereas in the abnormal lung, it is the bronchi, bronchioles and the alveoli is filled with the exudate. So, because of this inflammatory process, there will be a problem occurring during the exchange. So the whatever air is going inside is not coming out freely, and also because of all those things there will be a poor oxygen is present in the blood that lead to hypoxemia. This hypoxemia lead to respiratory distress among the children. So this is the altered physiology is happening during the case of pneumonia. Let us see the pathophysiology in detail. It has 4 stages. First stage is the inflammatory stage. In this stage, the lung become inflamed and edematous. The organism reaches the periphery of the lung and it proliferates to form inflammation. So, the child is suffer with cough, fatigue and shortness of breathing in this stage. Next stage is the stage of hepatization. So, during this stage, lungs look like red in color and fully inflamed and consolidated. So, this stage the child is manifested with shortness of breath, fever with chills and increased productive cough and poor feeding. The third stage is grey hepatization. So, this stage the lung look like grey in color. Inflammation starts to reduce in this stage due to phagocytosis action. So, in this phagocytosis action, the pathogenic organisms are destroyed and the lung is slowly recovered. So, all the signs and symptoms are slowly decreasing in this stage. The last stage is the resolution stage. Here, all the inflammation is reduced and the lung restored normally. Let us see the clinical manifestation of pneumonia. So, usually the onset is sudden with high fever and chills, and the child will have fatigue, poor feeding, restlessness, indrawing of the chest, and also grunting. Grunting means it's an abnormal sound. It is occur during respiration because of this dyspnea. And there are also flaring of nasal is there. This symptom is occur because of dyspnea. And also there will be a diminished movement of air, especially in the affected area. So then some child may end up with the pleuritic pain and tachypnea. These are the important signs and symptoms we can see in case of pneumonia. So, during the physical examination, when you do percussion, there will be a localized dullness can be seen in the affected side. When you auscultate the lungs, there will be a crackling or bubbling noise that's called rales is occur because of movement of fluid that is filled in the tiny air sac. And also we can notice the lack of breath sound, especially in the certain area where that absence of air in that area. So these are the some of the findings you can notice during the physical examination. Okay, let us see the diagnostic evaluation of pneumonia. First of all, routinely do the complete blood test. So, in the complete blood test, the WBC level will be increased due to absolutely it is due to the infection. And another thing is there will be increased polymorphonuclear. Again, they have to take X-ray. The X-ray will show the patchy appearance or patchy white spot that indicate pneumonia. And also we can also take the throat culture to identify the organism and treat accordingly. So, after the diagnostic evaluation, we can discuss the treatment. The furthermost important treatment is antibiotic. So, it helps to reduce the or destroy the bacteria or that microorganism. So, mainly penicillin, amoxicillin, azithromycin can be given, and IV fluids should be given in order to maintain the fluid and electrolyte balance. Administration of oxygen also help to reduce the dyspnea and restlessness among the baby, antipyretic should be given, and also we can also give the bed rest, that is very important. Bronchodilators can be given in order to dilate the bronchioles, and mucolytics also given for reduce the mucus secretions. So these are the treatment should be carried out in case of pneumonia. See the nursing management of child with pneumonia. First of all, the reduction of fever, that is very important. The high fever can be reduced with the help of antipyretics, and we can give step punch also, and monitoring the temperature of the baby very frequently, and maintain the patent airway. That means you should always keep the airway free from secretion. So we have to maintain patent airway. Whenever the secretion is present, we have to suction it and remove the secretion. Administer the oxygen to prevent hypoxemia, because all know that because of poor oxygen exchange, there will be a less amount of oxygen that is present in the blood, so the child will suffer with hypoxemia. So to avoid this, we have to administer the oxygen. And positioning, that is very important. Keep the baby in semi-fowler's position. It helps to improve the respiratory function. Then we have to give the humidified oxygen and monitor the pulse, and also you have to oxygen saturation should be monitored by using the pulse oximeter, and change the position frequently. So whenever the condition is little better, we can encourage that child to do cough and breathe exercise, and also you can teach the child how to do the cough and breathing exercise. This cough and breathing exercise will help to expand the lung and also help to bring the sputum out. And give warm fluid. Always give warm fluid, that is very important, because it helps to liquefy the secretions. And hydration of the baby is very important. The hydration also help to bring the secretion out. And whenever possible, as per doctor order, you have to give nebulization, and it also help to relieve dyspnea and liquefy the secretions. And always promote rest. This giving rest will conserve the energy as well as it reduce the dyspnea. So these are the important nursing management you should keep in mind while you are carrying the baby with pneumonia. Let us see the complication of pneumonia. The first one is the lung abscess, because that this is not treated well, then lead to lung abscess and collapse of the lungs. You can see that picture how the one lung is collapsed. Then you have to see there will be emphysema and pleural effusion also there. So these are the various complications that occur due to pneumonia. So today we have discussed about the pneumonia. It is one of the important topic, and it is one of the important disease condition that is commonly occur among the under 5 children. So you have to be very carefully treat the baby, otherwise the relapse will occur. I hope you all understand this topic well. Thank you for watching.
Please like, share and subscribe.